Welcome to Voices of Indianapolis, where we explore the narratives of innovators, collaborators, and communicators shaping our city. I'm Jeff Edge, your host on this journey. Join us as we uncover their strengths, glean insights into their views of Indianapolis, and unravel the qualities that make them exemplary role models. Through candid conversations, we aim to illuminate their impactful projects, collaborations, and communication efforts that are propelling our community forward. Together, we'll celebrate these influencers, fostering inspiration and dialogue to forge a stronger, more united Indianapolis. Thank you for tuning in to another episode of Voices of Indianapolis. I am Jeff Edge, alongside here with Erin Conboy today, and Nat is doing the interview this time. Erin, could you start off by telling us a little bit about what you do?
Yeah, so I am a physician at IU Health. Particularly, I see children at Riley Hospital a lot of the time. But my job involves a few other things, including running a rare disease clinic with our team, as well as being a program director for the medical genetics program.
Hello. So I'm just a little curious because Coach just told me a lot about you, and so I was wondering what's your story? How'd you get here?
Yeah, that's a really good question, because it was never planned to be the way that it is.
Is it ever?
I hope not, because that certainly isn't my story. But so I in high school really loved biology. I thought when we used the Campbell textbook way back then, and I thought the coolest thing was that this tobacco plant was crossed with a lightning bug, and somehow that lightning bug light was expressed in the tobacco plant. So you had a light up tobacco plant, and there was a picture of that, and sort of the idea of how they crossed that from a genetic standpoint. And I thought it was super cool. Went to undergrad, Grinnell College, and learned a lot about biology. Love biology.
Where's Grinnell at?
Grinnell's in the middle of Iowa.
Okay.
Yeah.
Are you from Indiana?
No. I was born in Philly, moved around a whole bunch. I've lived in Michigan, Ohio, Georgia, Florida, and then Iowa for undergrad. And again, kind of, thought maybe research, maybe physician, didn't really know, but applied to med school thinking like, no way I'll get in. I'll do my second choice, but you got to try, right? And so by some miracle, I got into medical school and decided to work with kids because they're resilient and a joy to work with. And when they're sick, which is awful and breaks your heart, they want to get better. I didn't see that as much in the adult population. It was more of a kind of unfortunate situation where, they had gotten themselves there because of overeating or smoking, things like that. And then there wasn't a lot of drive to get better. So I liked the kids for that reason. Went to pediatric residency thinking I would be a part-time pediatrician because I wanted my own kids and wanted to have time for that. And then met a medical geneticist during my pediatric residency at up in Rochester, Minnesota at Mayo Clinic. And
Which is a big deal, right? Like working at the Mayo Clinic.
It was really great training. I'm very happy that I was able to spend time there and see how they kind of had their patient interactions set up from bringing patients in for a week to do what's called like a Mayo workup, and that coordination and that ability to like make sure that the patient experience was very positive, which I haven't seen as much at other places. And so I loved seeing how that really helped the patient experience. And so met a medical geneticist, Dr. Salman Kermani, who inspired me to become a geneticist. And that's how I'm here. There's a lot of little things along the way, but that's why I applied to medical genetics residency, was because I saw patients with him and was able to help one of the first patients I saw while shadowing him get a diagnosis that was previously for the entirety of her life, which had been 5 or 6 years undiagnosed.
Wow.
Does that happen to be Allie?
That's not Allie.
Dang.
Yeah, but Allie's a really interesting story. Absolutely. Allie was enrolled in our Undiagnosed Rare Disease Clinic, and we were able to get a diagnosis for her that way because she had been undiagnosed for, again, years and years, was born with what was thought to be a mitochondrial disorder because she had low tone, but over time also had skin issues, and was, had difficulty growing and gaining weight and things like that, and a lot of mucosal problems, which is the lining of the esophagus and stomach and mouth. And we were able to complete genetic testing and interpret that genetic testing and help her get a diagnosis. But in rare situations, and this was one of them, thankfully, we're able to recommend a medicine that actually has improved her mucosal lining problems and her skin problems. It's just a B vitamin that's involved in the pathway that she has that's deficient.
Wow.
Good gravy.
So you did mention in your introduction
Yeah.
about a Mayo Clinic, if I'm saying it right or wrong.
Mayo Clinic.
Mayo
Yeah.
Clinic. What
Yep.
exactly were you doing?
Yeah, that's a good question. So after medical school, you apply to residency, which it's a unique situation, much like a military type match where you put in your list of rank order where you'd like to go. And the residencies that you would apply to, kind of like a job interview, puts in their own rank order, and a computer system matches you up. And that's where you end up going to residency, which is what you need to complete in order to be a practicing doctor. After medical school, you have an MD, but you don't have the ability to see patients independently until you complete a residency where you're supervised seeing patients. And at the end of that residency, you're essentially graduated to be an independently practicing physician.
Is that where they took that from? The military? Where did they?
I don't know
What
where it
what else
came
is like
about.
that?
The system is called ERAS, and I forget what exactly it stands for, but it's apparently helpful for both ends, right? Like where the people who are putting their rank order lists are prioritized in some way, and then the residencies are prioritized in some way, and apparently makes it work out the best way. But there's not a, if you match to that place, you're going to that place, and there's really no other option other than matching the next year, and not kind of working that year. So,
Wow.
yeah, it's kind of got to do it.
That worries me. Okay. Going along with the Allie case.
Yeah.
What advice would you have given? What advice would you give families dealing with undiagnosed genetic conditions?
That's a really good question. So I think step one is to talk to their primary care about it, whether that's a primary care pediatrician or family medicine provider. Tell them why they feel as though their child has an undiagnosed rare condition. And you can actually ask that provider for a genetics consult. Can I see a geneticist? Can I see a medical genetics provider, whether that be a geneticist MD trained or a genetic counselor, master trained genetic counselor. And either provider can help with pre-test counseling and picking the right test for the patient. But it's really, you can't go and schedule an appointment with a genetics provider. Usually you have to get a referral from another provider for the most part. And then if that doesn't work, I do have a plan B for families, and that is applying to the Undiagnosed Diseases Network, So if you Google Undiagnosed Diseases Network Gateway, you can find a link online where you can apply, put in all of your demographic information, but you need a provider letter. So you need some provider in your life, in your medical care, to recommend that you go through the Undiagnosed Diseases Network. And then a team will review that application and determine if they should come in for a UDN workup, which is kind of like medical genetics appointment on steroids, because like you haven't been diagnosed despite genetic testing or despite multiple modalities. And then the UDN becomes involved to figure out if we can, quote, solve your case. So that's a mixture of clinical and research, though.
Okay, so you mentioned 2 different types of genetics.
Yes.
Dang it. You mentioned 2 different types of genetics, right?
Yeah.
What's the difference between the 2, or are they practically almost the same?
So the medical genetics appointment and the UDN, is that what we're talking about? So when a patient is referred to medical genetics, that is a clinical appointment where you see an MD, a GC, or both, and a history, family history, and pre-test counseling is completed at that visit. Everything is clinical, meaning that the tests that are sent to clinical labs that are CLIA, CAP certified. There's no research-based testing. It's all within that. If this comes back positive, this is a clinical diagnosis that then can go into the chart and can go into the medical record and help you from that standpoint. The Undiagnosed Diseases Network, or Undiagnosed Rare Disease Clinic at IU Health, is a clinic that kind of molds in, kind of adds in a research component when the clinical testing through the medical genetics appointment is not enough to attain a diagnosis. So from that standpoint, we're looking at research-based testing, not CLIA CAP certified, but could be confirmed clinically down the road. But sometimes there are tests in a lab, across the world or at IU that needs to be done on a research basis to determine if that's the true underlying cause before it can be a clinical diagnosis.
How do you talk to people that are outside of your profession? Because I look at you like something of I read a lot of Dashiell Hammett as a kid, so like you're something of a detective on the precipice of a lot of medicine in our society, right? Or like, do you see it that way? Because I imagine you have to uncover a lot of stuff that is yet to be uncovered in our society, right?
Yeah. So I didn't think about that way until I was reading some articles about other undiagnosed rare disease clinics, and they use this idea of like solving medical mysteries and medical genetics detective and things like that. And when I thought about it, it makes sense, right? We are detectives and I had always thought about it myself as like, how can I find an answer for this family, right? Like one of my first experiences in that sort of like having to go above and beyond the appointment sort of situation was when I saw a child in training who had what looked like a lysosomal storage disease called meritolame, but the genetic testing only showed one of the 2 genetic parts that should be there. So autosomal recessive conditions, you have 2 copies of every gene. Everyone has 2 copies of every gene. And for autosomal recessive conditions, you need to have a misspelling or a pathogenic variant or a mutation. There's lots of words for it. 1 in each copy. Ooh. And so although she had symptoms of this disorder, she was only showing that she had 1 misspelling, which is not diagnostic. And despite the fact that there is enzyme replacement therapy for meritolame, she couldn't be eligible for it because her genetic test was inconclusive. And so I sent enzyme testing to try to prove that even though the genetic testing didn't show it, that her enzyme was deficient. And the enzyme testing came back normal. I was like, this all is not adding up, right? I've got an inconclusive test, a normal enzyme test, but I'm convinced that she's affected. And so we sent that enzyme test to another lab, and it came back abnormal, that enzyme was not functional. And then I asked our team, who at the Center for Individualized Medicine at Mayo Clinic is like the equivalent of our Undiagnosed Rare Disease Clinic at IU, because I tried to model it after their individualized medicine center. And I asked our team, it's like, can you take a second look at this raw data file and see if we're not missing something on that other copy of the gene? And sure enough, somehow the gene change hadn't made it to the file that went to the lab. That went to kind of the person who was reading the report. And so they only saw the one change and reported that appropriately, but there was actually another change on the other copy of the gene. And so we were able to prove eventually, after 2 enzyme tests and a genetic test with a reanalysis, that was the cause. And so all I was thinking that whole time, not that I was being a detective or that I was doing something, different than anyone else. It was just that I have this hunch that this is her problem, and this is the only way we can fix it, is if we prove that it is the true diagnosis. And once we did that, it was just like a huge relief to both me and the family. And I've kept in touch with them, for the past years. So yeah, it's one of those transformative experiences where you don't know how much it kind of like impacts you until you go through it. Yeah.
So going off of patient relationships, I was doing some research and I came across ratings, and so I was wondering, as a highly rated physician, what do you think contributes most to your strong patient relationships?
I think you kind of already hit the nail on the head, though. You're a detective.
Yeah, and I think it's this idea that I went into medicine because I care about people, and I feel kind of in every appointment that I go into that I want to connect with this person to build trust so that I can help them, right? And so from that standpoint, I have a lot of just like inherent empathy for people who are in a bad situation, and most of my patients are in at least a difficult situation because they have a health condition that's not currently diagnosed, which is a really confusing and sort of vulnerable position to be in, because you are confused by, why am I having these health concerns without a reason? But then you're also vulnerable because you don't have a word or a diagnosis to hang on those set of symptoms. And so you're confused, you're vulnerable, and you're not feeling well in the most part, right? And so then these individuals are coming to me oftentimes as almost like a last stop, right? I've seen X, Y, and Z specialists. I've seen endocrinology, cardiology. They're not giving me any answers. They're just telling me I have an abnormal test or I have this symptom. And I already knew I had that symptom, but I have no words. I have no diagnosis to put to this set of symptoms. And so we, as a genetics team, are responsible then to try to find that underlying cause, the reason why these things are happening. And that's what drives me, is getting these families and these patients answers. But I have this like side benefit of it being a very interesting field and an interesting way of finding that answer. Medicine had always been a little bit frustrating to me because a lot of diagnoses are descriptive only. You have X, Y, and Z symptom, so then you have this condition. And so it's pattern recognition and also trying to sometimes put, a block into a round hole, like it's not quite fitting, right? But with genetics, if you have a set of symptoms and you have a genetic change, and those two things go together well and make sense together, then I feel like we're explaining symptoms in a way that we can all get on the same page about.
So it sounds like the way your mind works is it kind of leads with a combination of empathy, problem solving, and curiosity, and all those things come together to do your job.
Yeah, that's interesting. I hadn't thought about, because I am curious, but my medical school personal statement started with curiosity. That's why I want to be a doctor, because I am curious, but I hadn't thought about that personal statement for a while.
You latched onto biology, not necessarily like space exploration or anything
right,
like that.
Right,
Interesting.
Yeah, exactly, because I was not very good at math, so physics and those types of things are kind of off the table because I wasn't very skilled at it. But biology, as long as I have a picture of something that's happening in my head, which you can do well with biology and pathways and things like that, then I felt like I could understand it.
Did you always feel like you were curious as a kid?
Yes, I do. I remember, because my sister and I are 5 years apart, so I was, in that stage of like playing outside and things alone, right? Because my sister was still a baby. And so I remember especially my mom got me a toy microscope with slides, and I would find little insects or little pieces of leaves that I could like put on this plastic slide and put under this microscope and look at it. So that was one of my favorite things to do outside, in addition to actually playing.
So you spend most of your life looking at things at a microscopic level, so
Yeah.
it makes sense. See that? I'm not interested in that at all. So I like macro level things.
It makes sense.
Would you say that curiosity carried out throughout the years?
I think it did. Yeah, I think I'm still curious, even with like interpersonal interactions, right? Like when I'm sitting across from someone in the office, like, why are you feeling so sad? Or why are you feeling kind of upset and angry at me? Is it because you're frustrated by your medical condition? Are you, where is this feeling coming from? And so I find it really helpful when you're faced with difficult situations, especially interpersonal difficult situations, is to come at it from a place of curiosity. Like, why are we not quite connecting on this, particular discussion? What can I change about things, or what can I find out about where you're coming from to make this go better?
Ooh. So let's see. What else do I got here?
Doing well.
Absolutely.
So I'm gonna kind of ask about your hobbies.
Okay.
Yeah.
I really only have one.
What is this word?
Brazilian Jiu-jitsu.
Thank you. So let's see. Where do I start with this one? So I was doing some research. I'm not a stalker. Don't worry. I came across some Brazilian Jiu-jitsu. How do you balance your work in medical genetics with your hobby, like practicing Brazilian Jiu-jitsu?
Yeah, it's a great question. So the balance is difficult. So today will be the third day that I don't practice jiu-jitsu. And I know that when I get to day 2 or 3 of not practicing, like I can feel the need to get out there and move and do it, right? And so I try not to get in a situation where I'm not, practicing for more than a day or two, because it helps me feel better from like a healthy standpoint. Like my body is healthy, my mind is healthier when I practice. And so where I train at Naptown Brazilian Jiu-Jitsu downtown here on Meridian Street.
I was looking for a place.
Yeah, it's only a mile from where I work.
Yeah, perfect.
And so from that standpoint, and there are so many classes there. There's a 5 a.m. class, there's a noon class, there's a 5:15 fundamentals class, and then a 6:15 class. That schedule helps me get into the gym and be able to find time. So I think it's a combination of that Naptown has a great schedule. It's close to my work, and I prioritize that over a lot of other kind of things like hang out with friends and things like that. I was like, well, yeah, I'll hang out with you. I just need to schedule you in, but I need to do jujitsu and that sort of thing. And of course, my kids always come first when it comes to that calculus as well.
What belt are you at?
I'm a purple belt.
Oh, right on. Okay.
Yeah.
What's the color belts mean?
So you start as a white belt, and that's kind of like you're just beginning. It takes somewhere between 1 and 2 years to earn your blue belt, which comes next. And as you go through the belt progressions, you get a piece of tape on the belt that shows that it's a degree, so that you've learned something more than when you initially got the belt. And you get 4 stripes on your belt before you go to the next belt.
Ooh.
After blue belt, then is purple belt, brown belt, and black belt. It takes
2 away.
Yeah, it takes at least 10, but sometimes 15 years to go through that belt progression.
Oh wow.
Yeah, well.
I don't have that type of
Not yet.
dedication.
You got time.
There's time.
So let's see. Speaking about kids,
Mm-hmm.
I think I found one of your kids' name, but I can't find the other. Benjamin?
Benjamin Jin, yes, Benjamin and William. So they are 10 and 13, and we all live in Zionsville. And yeah, dropped them off at school this morning. That's what led to my lateness. I really think it would be great if they could both be ready at the same time, because they're both in middle school.
That's asking way too much.
And then I could drop them both off at the same time. But instead, it was a trip to go drop off Ben, come back, drop off William, and then come here. So.
Where was I? Train of thought. It's gone.
Kids.
Oh yes. Do your kids enjoy the jiu-jitsu as well?
So I did get them into jiu-jitsu, and we did all enjoy it for a time, but both kids have since not wanted to go, and I didn't want to push it too hard. I just feel as though if they're pushed to do it, they might resent doing it, and it might become one of those things that's unpleasant for them. So Ben is now in wrestling.
Ooh.
And
All right.
yep, we just had our final match for this rec league last night, and he did pretty well. And then William is doing a lot of lifting, so he's getting strong that way. So I'm happy that they both do something physical that then, if they wanted to get back into jiu-jitsu, they both have had good foundational, like a few years there. And so it'd be easy for them to get back into it with what they're doing, the wrestling and the weightlifting. So in the back of my mind, I keep hoping that they will eventually come back to jiu-jitsu.
Do you put some of your genetic powers, I'm gonna say, into your kids?
Yeah, that's a good question. So I do like talking to them about and teaching them about genetics. And they've gotten to the point where, they know the things that I know and will ask me about it. So I enjoy that. And when they get to those parts of school, whether it be anatomy, biology, genetics, I really enjoy helping them with it and, helping to explain it. And then, quizzing them on it. And they're fairly bright, so they catch on quickly. Yeah. So,
I came across someone named Bill Conboy.
Oh, yeah.
Who is that?
That's my dad.
Oh, my gosh.
Yeah, Bill Conboy. He is, my father. They currently live down in St. Augustine, Florida. And so I was pretty excited that they moved there, because that means that for vacations we can go visit them. And he's been my inspiration, I think, as far as curiosity goes, for sure. He was a philosophy major in college, and then he's a lifelong learning type person, right? So he retired and just started reading books that he, hadn't had time to read before, or that he wanted to reread at this part of his life. You know what I mean?
Smart.
Ooh.
Yeah.
That too.
Yeah, and so, and he has, because of his, excellent ability to write and proofread and things, he has throughout my entire life helped me write things. So whether it be, a paper for biology in high school or college, or my philosophy paper in college, or even recently some grants that I've been writing.
Ooh.
Like kind of just send it his way, and he helps me proofread it. And it's been, kind of we've shared that part of things for a long, long time.
Do you feel like your dad's bringing that on to your kids?
That's a good question. It's when we do visit, I think he does impact them in that way. He teaches them little things that I had forgotten to kind of teach them. So I think he is impacting them when we see him. Yeah, through that. Yeah, I think so.
What's a story when your kids have gone over?
So, oh my goodness. Let's see. When we go and visit Grandpa, I think let's see. I think some of their one of William's favorite things is to kind of sit and watch Jeopardy with him. So that is the thing that like all of us do. Ben has a ever running motor, so he's still kind of bopping around the house but William, I and Grandpop all sit down and listen to and watch Jeopardy and try to answer the questions. And I think William is silently impressed by how much my dad knows, and likes to try to answer the questions as well, and has been slightly more successful than I have, especially on like things like history and geography that I've kind of forgotten a lot of.
Have the questions gotten easier over the last few years? A lot of people feel that way.
I don't know. I'm not sure. Or maybe are we all learning?
Maybe. I don't know.
I'd like to think that.
Thinking about the future.
Yeah.
What do you hope the future holds for rare disease research and clinics like the URDC?
Yeah. I really hope one day that the funding will be there for rare disease research. Right now, we're very understaffed, underfunded, under-resourced. And it's because rare disease affects very few people from an individual standpoint. So individually, a new diagnosis may affect only 12 individuals in the world, right? Because it's new and we're only just learning about it. But if you take rare disease and think about all of the rare diseases, all of the genetic conditions, it actually affects 5% of the population worldwide. So we've got 20,000 genes. We know what 7,000 of them do approximately. Each of those 7,000 genes have some other kind of diagnoses along with them. So we have about 10,000 conditions. And each one individually only affects a few, but taken together, 5% of the population. And I don't think that is understood well enough to get the funding that it deserves. It's very difficult to describe a new gene. It takes a lot of time, a lot of effort, a lot of experiments, and a lot of collaboration with other individuals, because we need to find the gene, find other individuals with similar symptoms and have a gene change in the same gene, and get all of those individuals together and described in an article, in a publication. And that takes a lot of resources, manpower, and money to do experiments to prove that's actually the underlying cause. And that's lacking for us, and it's lacking for a lot of rare disease clinics. Mm-hmm. And so I've gone about like different ways, right? We've applied and gotten NIH grants. We've applied to other kind of scientific type grants. We actually were awarded a grant from the Kendra Scott Foundation. She's a jeweler, and she had these kind of publicly available grants. As long as you were helping children, you can qualify to apply to that grant. And then we've tried to partner with the Riley Children's Foundation for philanthropic funding. And although they love what we do, finding a donor is really difficult because of that knowledge gap between, what is a rare disease, how can money and funding help rare disease and help patients. I think there's a huge kind of knowledge gap there that's part of the difficulty with funding.
Are we as a country leading a lot of this work? You said worldwide 5%, right? Are we?
Yep.
Who else is leading a lot of this work?
Yeah, so the NIH and the UDN, I would say, are the leaders in rare disease research. And they are trying to create a model where each individual institution that they accept as a clinical site, like Indiana University was recently named a clinical site for the UDN, so that's why they can apply to see us. But they're trying to limit funding that they're providing by, essentially like allowing other sites to be a UDN site funded on their own. So we're part of the crew with some limited funding, but in that funding grant that we applied for, it said very specifically that this is not enough funding to have a rare disease clinic. You have to have support departmentally and you have to have support philanthropically. Otherwise, essentially your rare disease clinic might fail unless you have those other sources of funding in addition to the NIH support. Ooh. So they know that this is not going to be able to be a fully funded NIH type of endeavor, that we need to find other funding. So.
Yeah. Thank you so much for raining your super knowledge on us today.
You're welcome. I'm happy to do it. It's been fun.
Thank you for coming up.
Yeah, no problem.